having dinner at our son and daughter-in-law and grandson's house in January. And when we got up from the table after dinner to go home, it was Zachary's bedtime, George sort of lost his balance, and his knee buckled a little bit and he felt off balance. So we sat him down and we waited a few minutes, got him out to the car, brought him home. But a dear friend of mine who works in the ER at Dominican Hospital suggested to me that we should really call his primary care doctor and work this up because it didn't sound right to her.
So they immediately got a CT scan at that point. And what they found was that he had an abdominal aortic aneurysm. And those are fairly concerning because if left untreated and if they're big or enlarging, they can rupture or tear, and a lot of people immediately die from it.
I'd had an uncle who had an artery rupture, and they didn't get him to the hospital in time.
Well, we immediately called his cardiologist, Dr. Sani, and Dr. Sani came in and evaluated him, and we looked at the aorta, and at that point his aorta measured about 7.2 centimeters. Normally we get worried when the aorta is 5 centimeters, so as you can imagine, we were fairly concerned. So we quickly got him teed up.
We felt very lucky to get these doctors because we'd heard of them, and they were in Santa Cruz. I didn't have to go up to the Bay Area or the city, and I could be at Dominican, which is about 2 miles from me.
Now, fortunately for him, he didn't need to get his abdomen opened up and a big surgery to get his aorta repaired. We could do it with less invasive. And we brought him to the hospital for something called an endovascular aortic aneurysm repair, EVAR for short. We put a stent inside there. If you have good anatomy, we put a stent that covers that aneurysm or that balloon and takes all the pressure away from it so that it reduces the risk of that popping. All that involves is a needle stick in the groin, and we go up with wires and catheters, and using x-rays we're able to put this stent in the proper position. And once it's in position, it starts working right away. It reduces your risk almost immediately of a rupture happening or a tear. And eventually, over time, months to years down the road, the aorta will start normalizing in size and go back to being a normal aorta.
I was really amazed about how smooth everything went and how on the ball all of the nurses and technicians were.
George did great. He went home the next day. He had very little pain associated with the procedure. He tolerated the procedure very well, and I think he went back to normal activity after about a week or two.
I feel really good. I felt like I hit the ground almost running. We walked right away, starting with one part of a block, and then 2 parts of a block, and then a whole block. Pretty soon I was up to a mile or 2 and then more miles, and I felt good. And I'm also a boogie boarder, and maybe it was 4 weeks or so, I was able to go in the water. So I go out at Steamer Lane and have a great time. And so I feel like I'm back.
Our patients, we're looking at providing care to our patients in a way that allows them to have the fastest recovery, the shortest hospital stays for many reasons, and the easiest and quickest recovery back to normal routine life.
George and I have 3 sons, and we are really blessed with 3 absolutely wonderful daughters-in-law and 5 amazing grandkids that we just adore spending time with. We feel very, very lucky in the family we have.
We're lucky.